Director of Health and Community Education at Piedmont Healthcare. Thank you so much for being with us this morning.
Hi, thank you, Victor. Good morning.
Good morning to you. Let's start here with McConnell and potential reasons for this. He suffered several falls. We knew about one earlier this year in which he suffered a concussion. There was one before that and then one after. Could there be some correlation between those falls and what we watched this week?
You know, always there can be correlations, and when you look at people as well over the age of 60, we have to think about different things like comorbidities or different medical conditions. In this case, it was actually quite stark to watch him. There was actually a freezing of about 20 to 22, 23 seconds, and sometimes we see that in a type of seizure called absence seizures or petit mal seizures. So in these types of seizures, you literally stop in your tracks. You stop talking, you stop walking, whatever you're doing, you absolutely cease doing it until the seizure passes, and then you continue with your normal activities, and you really don't have a recall of what happened during that period of time, including people who were talking to you. And it appears that it could be a type of absence seizure, certainly could be a TIA, transient ischemic attack, or a mini stroke, or any type of electrolyte imbalance, but it actually is quite stark. What's interesting in the absence seizures is you don't often need medical intervention if that absence seizure is already known, and you do return to full function, including cognition.
So he won't answer any more questions. He only said that he's fine. What would you need to know to agree with him that he's fine?
Well, obviously, I don't have access to his medical records. We absolutely would need to know what are his medical records. It seems that they've been pretty absolute in that he did not receive medical care. And that leads me to think that whatever happened, they knew about it, and perhaps it has happened before, and this is the first time we've seen it on camera, which is why if he has a history of having absence seizures, then they may not have sought medical care, but this was the first time we had actually seen it on camera.
Let me read this statement from his office. Leader McConnell appreciates the continued support of his colleagues and plans to serve his full term in the job they overwhelmingly elected him to do. Let me ask you about Bronny James. 18-year-old LeBron James' son was released from the hospital on Thursday, suffered cardiac arrest during practice on Monday. 18 years old. How common is that for someone this age?
You know, unfortunately, when we look at the data of Division I, NCAA Division I athletes, the black athletes who play basketball have a 1 in 2,000 risk of cardiac arrest. The white athletes, males who are playing basketball, Division I basketball, have a 1 in 5,000 risk. So it's two things that are interesting. It's specific to basketball, and there's an increased risk in the black players, in the male players specifically. And so we need to start taking a closer look at that. Are they not getting the same type of physical exam screening through the course of their athletics as they're growing up? Or are there other things at play that are being missed, and we need to understand what those are?
That is interesting that it's specific to basketball and black athletes.
That's right.
So now that we see this, he's at home resting. How soon would he be able to return to practice, workouts, the game at the level at which he plays it typically?
And so I'm assuming that he is home probably with a monitor. And he was released fairly quickly. So that is actually really good news. Came out of the ICU quickly and then was discharged quickly. At home resting, but probably being monitored with a heart monitor. And so the rest of that workup will continue as an outpatient, and it will really determine the trajectory of what is recommended for him going forward. And we always look at this in compilation. The player actually has a lot of say-so in what is going to happen to his future. So we have a group decision-making. And so the player's voice is important as well in that decision making, even when all medical information is available. So we'll see what that team that will include the opinion of Bronny James, what they reach.
All right, Dr. Jane Morgan, thank you so much.
Oh, thank you.
All right, still ahead, the top